Good morning. I have a busy day today with a lot of consults, and I have one patient I'm super excited to meet. Her name is Pixie Fox, and she reached out to me because she has some plastic surgery concerns she would like to discuss with me. She sent a few links, and I've seen her on Instagram and actually in the media before. She is a model who wants to look like a living cartoon from the movie Cool World. I actually had to look that up because I wasn't sure what that was. I know that she does want a look that is a little bit extreme and something that's a little bit atypical, but I approach every patient with an open mind, non-judgmental, and I'm looking forward to meeting her and getting to know her a little bit better and seeing what she's interested in doing. So we'll see how it goes. It should be interesting.
Nice to meet you.
So why don't we start with why you're coming in here today?
Yeah, so my goal is to look like my version of a living cartoon.
Okay.
So I want to exaggerate all the female parts. So for example, I had some previous procedures to feminize my body, and right now I want to continue that.
Why don't you start from head to toe and just tell me a little bit more about what things you think need to be changed on you.
I have some asymmetry in my face that I want to fix. I want to do a small correction on my nose. I want to maybe this. I think maybe this is better to show like in pictures where I can show.
Okay, do you have your phone? Do you want to show me the pictures?
Yeah. Fix the tip of my nose because it's a bit rounded, and before I had more of a pointy nose, and I want to get that back.
Okay, so when was this picture taken?
That was taken 1 month ago.
A month ago. Okay.
So this is the pic that I look now. This is the Photoshop picture.
Oh, I see. Okay, so now let me ask you something. Did you notice that it felt more round immediately after your last surgery?
Yeah.
Or was it progressive? Like, did you notice it get more round over time?
Well, it's maybe like after 1 to 2 months after the procedure, when the swelling started to go down, I noticed that the tip never sloped. The doctor said that the tip would slope and get more pointed by time, but it did not. So my tip is very, very rounded, and I want to fix that.
Did you have, so for your previous rhinoplasties, because I know that you mentioned that you had 3, is that correct? Did they mention in any of your surgeries that you had scar tissue from one of the previous surgeries?
Yeah, I know that I have scar tissue that has been building up. So I have it. They went inside from my nose, so I have more scar tissue inside my nose than you can see on the outside.
Okay.
So I do have a minor breathing problem, and I have scar tissue building up, so I know that I have a lot of scar tissue in my...
For your nose, in that very first surgery, did they take down a bump and break the bones? So did they like make it thinner and sort of and make it more curved and ski sloped?
They shaved down this part just
okay.
a tiny bit, but instead of, because I said I wanted a straight thin nose, then I was not looking for that extreme look back then. I just wanted a straight, thin, nice looking nose.
Sure.
And so I told them that I wanted them to shave down the little bump here and make the tip smaller.
Okay.
But instead they just shaved down a tiny amount here, and they put an implant up here, so it made my nose look even bigger.
Right.
And I built up scar tissue on the tip of my nose, so after the procedure my nose was bigger than before.
Right.
So that's why I felt like I need to redo this, because it was not what I wanted.
Okay, so did they take that implant out and then take more bone and cartilage down after that?
Yeah, so they took the implant out and then broke this part here.
Okay.
Then I think that it healed up.
Here.
Instead, yeah.
You can show me.
Instead of this bone here healed up a little, like pushed in. So when I did my 3rd procedure, they didn't, instead of correcting this issue with the bone, I took cartilage from my ear and put up to fill up this
I can
part.
actually see the cartilage.
Yeah, you can see it when I do like that. So
it really shouldn't be
so
mobile like this.
It leaves me with like a breathing problem that wasn't fixed, and they only like put makeup on it instead of fix the problem.
Okay, I'm just going to take a quick peek inside your nose. That way I can sort of see if there's any visible scar tissue. Is there one side that you have more difficulty breathing on than the other?
Yeah, it switches a bit. So
Okay.
sometimes I'll be better on one side than the other, but mostly I have more issues on this side.
Did you ever have a history of nasal allergies or sinus infections prior to your surgery?
No.
No, you didn't. Okay, so you've never been on any sprays or irrigation or anything like that? Okay, let me take a quick peek inside. Okay, tilt your head back just a little bit. Oh, I see what you're saying. It's where they made the cuts.
Yeah. So like on this side here, there's a lot of scar tissue right up here.
So there's two things going on. I mean, you do have some scar tissue pretty much where they made the actual cut, but I think that part of your breathing problem is because there's these things called turbinates. If you look in your nose, they're the balls that hang down. And what they do is normally they humidify air when you breathe in. Your turbinates are actually quite large, and they're also a little bit inflamed. And so part of the problem, like I said, is that you can't breathe, is that they're large and kind of medialized. Usually when we see something like this, what we recommend is putting you on some irrigation and a steroid spray to shrink it, so that way at least it can, open up your airway a little bit. I mean, there are surgical things that you can do, such as trimming them or moving them to the side, but usually if you can do something like that's pretty benign, just using a spray and irrigation to shrink it to help your breathing, it's always best to start with that first, because that will always help you when you have like more space inside your nose.
Yeah.
In terms of the shape and sort of what you want it to look like, you just need to know that for rhinoplasty, I always tell everyone that 50% is the surgery and 50% is healing, right? Because anytime you go in, there's always a chance that you're going to make more scar tissue. So that's why I was trying to understand from your first surgery what it looked like, and if you built up a lot of scar tissue in that first surgery, because sometimes what can happen is you scoop the bump off, or you shape the nose, but when you do the surgery you have to lift the skin. So what happens is during the healing process, that little space between the skin and the cartilage can fill with scar. Honestly, I probably would tell you just to leave your nose alone, because like I said, if you already had 3 rhinoplasties, especially the last 2 times they took the scar out, one, I don't know how much big of a difference it will be to go in again and take the scar out if it's going to come back. I think to see how your body responds, it may be best to look at pictures before and after the last 2, so that way we can say, okay, this is what you started at before your last surgery. They removed the scar, how did it respond? No change, worse, better, you know what I mean? Because that will gauge sort of how you heal and what's going on with your nasal tissues. I would say if before and after, when they went in to try to take the scar tissue out, it was either the same or worse, then I'd probably tell you not to do another rhinoplasty or revision, because it's just going to either 1, come back again, or 2, maybe be worse, you know what I mean? Because you don't want it to be any more full than it already is. Is there anything else on the face that you are thinking of changing?
Yeah, so I'm looking into doing the buccal fat, and also I have some symmetry in the jawline that I want to fix, because I had an accident before where I think I got a crack in the jawline. I was in a snowmobile accident, and so this side is a bit more prominent than this side. So I want to fix the symmetry in my face, so it's
What procedures have you had in your face? Do you have any filler in right now, or do you have any other products?
I have some, half a year ago I got some fillers in the cheekbones, and also a bit on this side of the jaw.
Like I said, I think that right now, because you have so much product in your face, you should definitely at least see at baseline, because if you're going to fix the underlying anatomy and the underlying structure, you want to do it when there's not a lot of fluctuation on top of it. Otherwise, you're going to end up really uneven.
Yeah.
Okay. Yeah. Okay, so let's talk about the body stuff. All right, so why don't you tell me what you would like to fix and what you've had done already on the body.
Yeah, so I've done 4 breast surgeries.
Okay.
And then I've done, so I started off doing liposuction on the inside, then I did liposuction on the outside. That was different procedures. Different
Okay, and that was before you did the Brazilian butt lift?
Yes.
Okay.
And then after the Brazilian, took from the inside of my thighs and from the around my waistline all the way, and then put it on the butt. So I had to gain over 35 pounds for that. So they took out a lot of fat. They took out 4 kilos of fat, but they didn't put in so much in the butt area. So
so they did a liposuction where they removed fat from the inner and outer thigh, and you had liposuction from there before?
Yeah, they only removed from inside of the thigh.
Only from the inside?
Yeah.
Okay. And then around like the whole abdomen and the waist and the back, did they go all the way up your back? Do you remember having an
they
incision?
went all the way.
Like, do you remember this part being sore
No,
up here?
basically this part here.
Okay.
And around and here. So it was like that, not.
And they didn't go up here or
No.
anything like that? They didn't blend it or anything?
No, I didn't have much. I was mostly
around the bottom.
Yeah.
Okay. And they took 4 liters?
4 liters. Yeah, I had to get a lot.
Yeah. I mean, I can't imagine how you could give 4 liters.
Yeah.
Okay. But they didn't touch your arms or anything like
so
that?
actually right now I want to do another Brazilian butt lift and do some fine-tuning liposuction with that. So I want to do lipo on the back of my arms, on the outside of my thighs to get away with this small pad I have here, which didn't go away with the previous liposuction. And do more on the inside. I still have some fat here around the inside.
Did you do your knees at all?
The knees, they went down a little down here, but
Did
not
you
too
have any
much.
cuts or anything around your knee that you remember? How long ago was that?
It's this scar that's closest to.
Okay.
No, I don't have anything here, so that is that scar. And then, yeah, so they put the fat up here. So right now, what I want to do, I want to smooth this area out. So I want to take away this pocket.
Okay,
And
build on top of it.
Yeah, so I want to fill up this part here to get like the hips higher, so I don't get this pear shape. So basically, I want to remove the rest of the fat deposits. I want to remove the back side of my arm.
Okay.
I don't know how much, but I want to do some liposculpting there.
Okay.
And
A little bit.
like if it's possible, if you can get enough fat, maybe try to use that for to put it here on this hip area.
I mean, you're not going to have enough. Let me just see here if they did anything in your
It's
upper
more
back.
like I'm looking for fine tuning more than
volume.
Yeah.
Let me look. So let me have you turn so I can see the back. So I can see the shape. Okay, so that I think looks okay. You feel a little bit empty here, right?
Yeah.
I see that. Yes, I think that to get this more round, you would need at least, I would say maybe like 30 cc's of fat. I don't think I'm gonna get enough for 30 cc's on each side.
So
you know what I mean?
So I want to do lipo
in the knees.
Yeah.
Okay, let me have you undo your boot a little bit. And like I said, around the bottom here, you don't want to touch that. There's certain areas on the body where you're not supposed to liposuction. Otherwise, you're going to really see cannula marks. So if you want big volume or you want the hips to come out a lot, it's not going to be enough to really accomplish that.
No.
You know, so I just like to be honest about that.
Yeah, I know that. So right now, it's like, I know it looks good, it looks more than good, but I want to go to that extent, like extreme, to get away all the rest of the fat deposits. So the only place I have fat is going to be on my hip and on my butt. So I want to take away from the rest of the body. Also, I'm looking for a doctor if I'm going to do the butt and hip implants that is willing to put them in.
Okay, so for the hip and fat implants, that I'm definitely not going to do. I just think that it's not a good surgery. I think that there's probably very few plastic surgeons that will do that, just because, especially in this area, they do tend to get infected, extrude, migrate. People have a lot of problems. And I think long term, what I'm seeing a lot of is girls who got implants in this area, and they had issues with it, and then they want them out. But then once you take them out, it's sort of like anything else. You really stretch the tissues. So when you take them out, it ends up being this horrible, hanging mess. And like I said, I think that implants work great in certain areas, like facial, in the breast, things like that. But around this area that's so dynamic, where you're sitting and everything like that, I think a lot of people have a lot of problems with them.
Okay, so for me, I started off my journey by I've always been admired, always been very artistic and detailed, and I love details, and I see myself as an artist. And I've seen all the pictures of beautiful women out there and all the Disney characters and cartoons with the perfect feminine body, and I wanted to see, is that possible to achieve? So I started off a blog. Is it possible to achieve the femininity of beauty, or is it just an illusion, or can you really achieve it? So that's how I started off. I started off documenting all my journey, and I started to do my procedures, and I started to dedicate my lifestyle to my projects. So for me, this is not like people say that I'm dysmorphic and stuff like that. This is more like, this is my art and my project that I'm working on, and I'm building my career from it. So that is why I'm so detailed in my work, and I see everything, and it's really important for me to get it the way I want it. And it's not because I want other people to like me and look at me that I'm beautiful. It's more like I have an ideal that I'm striving for to achieve, and I want to come as close to that as I can. Yeah, so I've seen your Instagram and been following you for a long time, and I feel like, even though you don't know me from today, but I feel like we have a connection, and you see the detail just the same the way as I do it, and you know how to take care of your body, and you're really beautiful and notice details and live a healthy lifestyle, just as what I'm trying to achieve.
Okay, well, it was so nice meeting you. You're very, very lovely, and we'll talk some more, and we'll be in touch.
Absolutely. Thank you so much.
You're so welcome.
I'll get back to you soon.
Okay, and have fun in LA today.
Thank
you.
Bye.
Bye. So the consultation went really great. I think I have a much better understanding as to who Pixee is, and also who she is as a person and what she hopes to achieve. I think definitely some of the surgeries she's done are extreme, and I personally would not have performed those, such as the oversized implants, the rib removal. I'm personally against implants to the butt and the hip area, just because I feel that long term, a lot of women who get them have complications and issues, and they may look great right now, but 10 years down the road, or when they need to have them removed, they're really left with significant disfigurement. I think that a lot of the facial stuff that she hopes to achieve, it's a little bit difficult to assess, and it'll be really important to weigh the risks and benefits, just because it's always a consideration whether or not doing more surgery will actually make her look worse. One of the other hesitations I do have is that she's had multiple previous surgeries with multiple other plastic surgeons. In the end, I really only know and trust my own work. So it is a challenge to go into a site that someone has touched before at least once or twice, because of the unpredictability of the work that was done before me. I think that when approaching a patient, you have to look at them as a whole person, and also care for them, not just now when they're about to have a procedure with you, but also think about how anything you do will affect them long term. And so those are all things that I take into consideration when thinking about operating on somebody.